Remember we kind of like went through it.
Oh.
We got it at like the end.
Okay. Well, everyone, thanks for joining us tonight. So this is case study number 2, East meets West, an infectious disease case, also called Yang's illness. We'll start with the summary. So it starts off with Min and Wei, who are a married couple, and they're worried about Wei's sister Ying, a 51-year-old female, who has had a fever and pain while swallowing for a few days. Wei wants to stick with traditional Eastern treatment involving herbs, but Min thinks it's time to use modern medicine due to Ying's worsening condition. At first, Wei does not want to resort to medication and insists on using stronger herbs and hot mint tea to help with their symptoms. But as Ying becomes sicker, Wei's herbalist runs out of options and encourages them to take her to the ER where she's diagnosed with strep throat. And it says more specifically that Wei seems a little entrusting of Western medicine and doesn't want to go to the pharmacy when Min first suggested it earlier on. But Ying is initially started on penicillin before they realize what's going on with her. She actually gets a rash from it, so they discontinue it immediately. Once they find out that she has strep, they start her on gentamicin and she starts getting better. Dr. Smith is her doctor in the ER, who is a second-year resident, and he orders genetic testing to see if she is susceptible to rheumatic heart disease, which is a complication of untreated strep throat. And he also orders an echocardiogram because he wants to see if, since she was untreated for X amount of days, I think it's like 5 or 6, he wants to see if it's traveled down to her heart and if she's at risk for any of these things. And the reason he orders it initially is because, I guess, of being of Chinese descent, I think she's more susceptible to getting or contracting rheumatic heart disease. I have a note down here that says, it's important to note that when Dr. Smith mentions the blood work for genetic testing, it is very clear that Min and Wei both don't fully understand why the blood work needs to be done. And it specifically says that they only sign the consent form because Wei can see that the doctor's being friendly and he wants to help Ying. So they kind of sign it without fully understanding what's going on. It's a pretty big aspect of this. So Dr. Smith is then called down to the ER for several emergency cases and never comes back up to follow up with a treatment plan or explain the genetic testing forms for Ying when she's ready to be discharged. The case study ends by stating Dr. Smith forgot to include follow-up points in Ying's patient record, and now he was off on his next rotation, so he's no longer even in the hospital system. Dr. Smith's administrative assistant scanned Ying's genetic testing results into her chart, but did not document her results or his recommendations for preventative treatment options and follow-up procedures. And the results did come back positive, so she is more susceptible to rheumatic heart disease. And one of the last things the case study says in quotes is, Ying is now at a high risk for developing rheumatic heart disease in the near future if no preventative action is taken. So that is my summary. When it comes to the ethical dilemmas, so first we have beneficence. Wei realizes that the herbs are not making a difference and that they have to resort to a different type of treatment. And you can see that he starts to kind of put aside his own ego and do something new to help his sister, because at first he's very hesitant to do anything about it, and which is mostly his own ego getting in the way. The non-maleficence. Dr. Smith suggests genetic testing for rheumatic heart disease due to Ying's increased risk for her Chinese heritage. And then there was actually a few different examples of this. I seem to notice there was kind of like the opposite of some of these, like there was an example of maleficence in this, so I thought I'd throw that in there too. Dr. Smith could see that Min and Wei did not fully understand the need for genetic testing, but he handed them the informed consent form anyways. And instead of asking for a translator or getting an expert on the matter at hand, he hands them the informed consent and just kind of hopes that they'll trust him and sign it and go along with it. And then same thing with autonomy. Throughout this entire case study, it seems as though Ying actually has zero autonomy at all. Never once does it state that she makes her own decisions. It doesn't say that she voices her opinion in any way. The only time, if I remember correctly, that she even really says anything is, I'm trying to see if I can pull up the case study real quick. It like actually says like, oh, Ying says something in her native language. So it doesn't even say what she really says. It's just like, she just gets really scared. Oh, she asks her family if she's going to die, because she starts crying when they ask, or when the doctor starts talking about the need for an echocardiogram and checking her heart and whatnot. So throughout this entire thing, Wei seems to be the one making all the decisions for his younger sister. And then justice and fairness. I said that there weren't really any examples of justice or fairness. No one ever really followed up with care, especially in the last aspect. Everyone kind of acted like it wasn't their responsibility. Everyone was just kind of like, the doctor didn't come back, the administrative assistant just kind of scanned the information and then just let it go. That was kind of it. I don't know. I mean, I suppose you could say like one instance of fairness or justice is also Wei realizing that he needs to put his own traditions aside and do something new to take care of his sister, but there wasn't really more than that stepped out to me. All right, the principles of beneficence and non-maleficence. So what is the patient's medical problem? Strep throat was a diagnosis. It's not really an acute problem, or I'm sorry, it is an acute problem. It's a non-critical problem unless left untreated, which is kind of what happened here. Some of the complications it can lead to are abscess, rheumatic fever, rheumatic heart disease, which are the more serious ones. The goals of the treatment are to treat the infection promptly with antibiotics, which was not done right away, but eventually they got her into the ED and she got her gentamicin. And the various treatment options. So strep is pretty much always treated successfully when done so in a timely manner. And like I said earlier, if left untreated, the prognosis varies because you obviously have these higher risks of rheumatic fever, rheumatic heart disease, all these pretty serious complications of what's going on there. So the principle of respect for autonomy. The patient has been informed of the treatment and a need for further testing, but it's difficult to say if she truly understands the information. It never once mentions whether she understands what's going on or whether she fully grasps the seriousness of her diagnosis. Min and Wei are the ones that are translating for her, so it's possible that things are translated or misinterpreted because there was no translator present. Who's the appropriate surrogate to make decisions for the incapacitated patient? I suppose that would be Wei, who is her older brother. He's the one that was kind of making the decisions for her regardless. And is the patient unwilling or unable to cooperate with medical treatment? The patient was cooperating, but she seems to be relying on her brother to make all of her decisions for her. The principle of beneficence. Let's see. So what are the prospects with or without treatment for a return to normal life? I said without treatment, there is a good chance that Ying will develop further issues like the rheumatic fever or heart disease, which will complicate things. But there doesn't seem to be any scenario where she would be better off not receiving treatment. So much different than the first case study that we looked at, where there was kind of a, whether you take action or don't take action, what could happen. This is very much one of those scenarios where you need to take action or things will get a lot worse. Are there biases that might prejudice the provider's evaluation? I said the only bias that he used was somewhat for her benefit. It was he chose to do the echocardiogram and then the genetic testing to see if she was more susceptible to the rheumatic heart disease due to being of Chinese descent. So the only bias was kind of used in her favor. Do quality of life assessments raise any questions regarding changes in treatment plans? No, I said there is no assessment that raises any questions regarding quality of life or measure. There's nothing here that really needs life-sustaining treatment. It never really got to the point of that being a topic. Are these parties other than the clinicians and patients such as family members who have an interest? I said that the patient's brother, Wei, obviously has a lot of influence over her medical decisions, which I'm making the assumption is due to their culture. But he decided to use traditional Eastern medicine only after Ying had begun to decompensate, because they originally turned it down in the beginning. They didn't want to use any of the Western medicine because he was untrusting of it. Religion was not a factor in this case study, but culture seemed to be, at least in my opinion. Wei, like I said numerous times, has been making majority of decisions for his younger sister. And what are the legal issues that might affect clinical decisions? So in the case study, it mentions that Dr. Smith was unsure if he was explaining everything correctly, since this was not his specialty and he's only a second-year resident. And when he handed them the informed consent for the blood work to test for any mutations, it was obvious that Min and Wei did not fully understand what was being asked, but they signed the consent form anyways because they could see that the doctor just wanted to help. So I said the only legal issue here could be there could be some sort of legal ramifications afterwards because they signed consent without truly knowing what was going on. So I feel like if you kind of dug into that a little deeper, you might be able to find some issues with that. All right, so the alternative perspectives. So initially, I got the idea that Wei was being stubborn and kind of stuck in his own ways, treating his sister the way that he would want to, because he only treated her with herbal remedies and traditional Eastern medicine. They waited a few extra days to go to the doctor at all, and that was only because her condition significantly worsened, and Wei was getting pushed from his wife Min and the herbalist as well. Upon her admission, she started feeling a lot better due to the antibiotics and the treatment she received. And with the doctor's advice, they were able to find out that she's more susceptible to developing rheumatic heart disease. So it kind of came like Wei was in the wrong. Eventually, he trusted Western medicine, and there was all these different reasons of why it helped out. Between she got better, he wanted to do the echo, and they found out that she is more susceptible to this because of her genetics. After my alternative perspective, after reading into it a little more, after doing more of this assignment, you start to see that Wei was just trying to treat his sister the way that he was raised and the way that his culture has been doing so for thousands of years. And then after getting towards the end of the case study, you start to understand his hesitancy to go to the hospital at first. First and foremost, there's a language barrier, which just makes everything a lot more difficult and more intimidating from their perspective. The communication was very difficult between the doctor. The language barrier made it difficult for them to understand what they were signing. But I mean, like I said, he only signed it just because he knew his sister was sick and the doctor looked trusting. They trusted his recommendation and signed regardless. And lastly, I mean, he finally started to begin trusting Western medicine and trusting this doctor. And then when they needed the most, they kind of got left in the dark. So it was starting to take Wei's side a little bit towards the end here. And then the two provisions, I said provision 2, the nurse's priority is to treat the patient. And in this case study, that includes Min and Wei, the whole family. It's important to understand that all cultures handle illness differently, and it is clear that although Ying is an adult, her brother still has influence over her decisions. When there was need for consent or permission, Min and Wei should both be addressed along with Ying. And then provision 8, as a nurse, we must work with providers and other medical staff to ensure our patient is receiving the best care possible. In this case study, there was a great example of it's someone else's problem. The second-year resident, Dr. Smith, never followed up with the education or treatment plan. He never delegated to a nurse to go do so. The administrative assistant scanned Ying's results into a chart, but did not document the results or recommendations for the treatment or follow procedure. Ying seemingly fell through the cracks when it finally came time for the discharge teaching, and there was no one there to help her with her new diagnosis of increased risk for rheumatic heart disease. So my personal reflection and takeaways. Initially, I was frustrated with Wei for being stuck in his ways and refusing to get Ying medicine when she was first beginning to show symptoms, which might have prevented all of this from even happening in the first place. Eventually, they go to the ER. Ying starts to improve, which only further validated my thoughts on that. However, as Wei finally trusted the doctor and Western medicine, it left him in the dark when it mattered most. And my frustration switched from Wei to the second-year resident in the healthcare system, that specific hospital, for their lack of follow-up on a pretty serious matter. All right, so these were the two other questions that they had. A couple who does not speak English comes into the clinic for genetic testing. They are planning to start a family and are concerned that the wife's sister has cystic fibrosis. The clinic's consent form is in English, which the wife is able to read. However, the husband cannot read or speak English. So ethical, I said, find a version of the form in the husband's primary language or use a medical interpreter to inform the patient in person so he understands what's going on. The unethical is to just have the husband sign anyways because the wife gets it. So if the wife gets it, he should get it, right? That's the unethical one. The second one, a patient about to undergo gastric bypass surgery calls the nurse into the room. The patient whispers to you, the nurse, a concern that friends will learn about the upcoming surgery and pleads to keep her surgery a secret. The ethical explanation would be to explain that due to HIPAA, it is illegal for any hospital staff to discuss the patient's medical history or her upcoming procedure with anyone that has not obtained permission from the patient. And the unethical is the nurse explains that she just has no interest in telling anyone regardless, which I don't know. I thought this one was interesting because I wasn't really sure if there's an ethical versus an unethical way to keep patient privacy, unless I didn't fully understand this one. I'm not sure. But okay, so we are finally down to the discussion questions. I'm just gonna show these last two slides just to show that they are there as the end of my presentation. But yeah, the first question. How would you discuss the integration of Western medicine into the family while still honoring the family's traditional approach to medicine? I don't know, I guess I'll kind of lead us off here. I think this is tough because they obviously feel very strongly about sticking with their traditional medicine. I mean, I think those things get passed down for thousands of years because they clearly work. I don't think people would keep using them if they didn't do anything. So I don't know, I guess the way I would look at it is to maybe start off using the traditional approach. And if there's no improvement after a couple of days, then maybe you go to Western medicine. But you could argue that's kind of what already happened here, but maybe they waited an extra day or two than they should have.
Yeah, I agree with that. Like, I say give it like a good try with what they have always been doing. But if, like, when I read it, she was clearly having like trouble swallowing and talking and eating. So like those are really big red flags that should have been like addressed way sooner than they were, because clearly what they were doing wasn't working.
Mhm.
So,
Yeah, and I feel like it is important to respect their like culture and like if that's the way they're used to dealing with illness. I feel like it's hard also because with strep in particular, like the rheumatic fever that could come from it is so life-threatening and like dangerous. So it's not like you could just let it go and see what happens. So I feel like it's a hard like thing to know when to let like the Western medicine get involved.
Yeah,
well,
I
is
think
it the
doctors too can like, well, I know they did ask, but I feel like if they could get to understand like what they practice for different like illnesses for like this, and they could try to like educate them too on when and like clearly the family didn't intervene, I feel like early enough. So I feel like maybe if the doctors asked questions and got to understand their cultural practices, then it would show the family that the doctors care about their culture, and then they can try to like educate them on also integrating some Western medicine and like maybe when to like transition over.
think it'd also be good to validate for the family that it's like perfectly fine to use both of them and be like, that's awesome that you use those types of teas. Like those can definitely be beneficial. And then really explain the type of medicine that they're going to be put on and how it would work for them.
Yeah, another way I was looking at it was originally like, oh, maybe less severe things you start with all the tea, and then as things progress, you go to the medicine. But that's like, I mean, that's like again, kind of what happened here. It's like, it starts off. I mean, strep throat usually just starts off with a little bit of a sore throat. Maybe you feel it in your sinuses, and it just gets progressively worse. So it's like they probably started with the tea and it didn't do anything, so they tried something else, and it's like it's. I think it's deciding where you draw the line of, okay, this isn't working, we need to do something else.
Yeah.
All right. Question number 2. Was the communication surrounding genetic testing handled appropriately? Why or why not?
No, I don't think it was.
Yeah, I agree.
I feel like the doctor didn't take their time and realize like, okay, this family has a language barrier. There's also like culturally with their type of practices. And also like, I mean, we talked about like the culture with like the brother being the voice for the sister. And I'm sure that can be very complicated when you're busy in a hospital, probably have a lot of other patients to see. But I think that you obviously still need to like take a step back and take that time to really explain, especially to the sister. So she understood, not just the family. It seemed like they just rushed it to like, yeah, they wanted to help, but at the same time, they didn't know what they were signing for. So.
And I feel like since he was a second year resident and he like knew in the back of his mind that he wasn't going to be there that much longer and he was going to leave, and he's suggesting all of these things that she do, such as like the genetic testing, if he wasn't going to be there to relay the results of those tests, he should have like been responsible enough to tell like a supervisor or someone that this was his patient, this is what he was doing, and he needed to have the follow-up care like already in place because he knew he wasn't going to be there anymore. So I don't
Yeah, I mean, he really dropped the ball. Like
Yeah.
this could have this could end up, is this a true story? Do you know?
I don't know. I tried Googling the title. I mean, I knew the names weren't the actual names, but
Yeah.
I spent some time trying to find stuff and I couldn't find anything. Just like
I mean,
other examples of nursing situations like this.
Yeah, I mean, I know that we'll probably talk about this a little later on, but like if they had pressed charges, I think there would have been enough evidence to prove that this doctor would be in a lot of trouble.
Yeah, they didn't even document at the
Because he
end.
didn't document. But
I
then,
mean,
okay,
yeah, that's
sorry,
crazy.
I'm a little confused by this one part of the case study. It says in the discharge part, 2 weeks after just discharge, it's your duty
Yeah,
to
I
follow
know.
up with each. Is that referring to like you are the nurse in this situation?
I have no idea. I didn't.
Mm.
It was your duty kind of threw me off too, because that's the only aspect of the entire case study that makes it sound like I'm the one involved.
Yeah,
what I
and
mean?
now it's like, is this your fault?
I don't know, because they don't really mention. I feel like they might mention the nurse once or earlier on.
because nurses normally like say like for instance like in a pediatric office your kid goes to see the doctor's not usually the one who calls a couple days later to check on you, it's the nurse. So like
Yeah.
they look through your records and the doctor puts a note in there that says so and so had this, like please call 2 days later to see how they're improving, and you always get a call from the nurse. So I feel like it might be going towards that direction, like as the nurse
I agree.
they
I-
should
So-
have followed up. But do we know if the doctor
put those orders in, the nurse
Yeah.
wouldn't know that, right? I guess unless
Yeah,
Maybe.
on page.
Oftentimes, don't nurses also have the responsibility of being present when consent is signed and listening to make sure that the person receives the
That's-
education, right? Because
I
remember,
think you need a
if they
witness,
have a
yeah.
question, we can't answer the question, but we can say, did the doctor explain this part to
Mhm.
you again? So
Yeah.
I think you're correct in that it could be alluding to that. And then
And
also,
too.
Maura, you mentioned that like the hospital could be busy. And I was thinking about that while reading this, that people could take the side where it's like, oh, well, the system is so messed up that he had such a big caseload that that's why he didn't have the time to explain it to her. But I think it's really important he takes that individual responsibility that you folks were talking about to like follow up and yeah.
I also wondered too, like, I mean, we don't really know, but did he just say like, you know what, this is like a lot, like for the follow-up and stuff, like clearly this family needed that follow-up and extra education because of a lot of barriers, language, culture, the disease. They clearly didn't understand it, and that didn't happen. And then they were already susceptible for like reinfection. It makes me almost wonder, like, did the doctor feel like they rushed the consent form? Did they just feel like, you know what, like this is a too complicated of a case, I'm too busy to even bother? And a lot of times that's when the doctor would probably say like, let's follow up in 2 weeks, right, at that discharge teaching. So if the nurse who would have been present for that didn't even hear a discharge teaching, they wouldn't even know that anything needed to be followed up on. But
Yeah,
I don't know.
maybe part of this case study's point is that like us as the nurse, like when this patient was discharged, we should have been the one being like, wait, this wasn't handled properly. Or well, I guess this was after discharge. But even on the discharge part, like maybe the nurse should have been like, wait, we haven't explained enough to this family. I don't know.
Well, I think I'm gonna go there because I feel like it's a race thing that's happening here. Like they're undermining what they can comprehend and what they
Yeah.
can handle because they are non-English speaking people, and they just literally, they said in the case study that they didn't get the translator for the second part of it because family was present, and we know like 101, you're not supposed to do that. Like you always get a translator no matter what, and you don't rely on family members because they might not explain things the right
Yeah.
way. So I feel like that is a huge thing.
I mean, and it goes to show like why we just read the like COVID-19 and African Americans, like why minorities are higher risk for dying from certain diseases and stuff like that, because I mean, it does bring a race factor in this. Like, I feel like a lot of times the minority families kind of get thrown under the rug, unfortunately, in a lot of cases.
Yeah.
Yeah, and I mean,
Agreed.
I don't know. At the bare minimum, all they needed to do is get a translator. Like that's just the way I look at it. Like
Yeah.
Yeah, I
they
agree.
they have them in person, depending on what the language is and where you are. They have them on phones. It just
Yeah.
seems like a very easy thing to do that they kind of skipped over because he was just like, oh, like I don't just sign the form. Let's just get this going.
I've seen doctors do that in real life. Like they hate having to get a translating service. It's kind of
Yeah,
insane.
some people are very bothered by it for a strange reason.
I see it all the
literally have
time
a
at my
phone. Like they have a phone you can connect in people's rooms that have someone talking on the other line, or they have a video monitor like they had at Leahy. Like I don't
Yeah.
understand why it's so difficult. Like you have to wait, and yeah, it's a pain in the butt, but like
Oh yeah, at my
Yeah.
hospital, the hospital I work at, majority of the patients are Portuguese speaking, and I see doctors all the time come in and they don't get a translator. It's like a not as new hospital, so there's not like the, you know, you can FaceTime them type thing.
mhm.
They have to wait for the actual translator, but I watch them like not wait at all. Just,
No
like,
patience.
and use
I
the
feel like
fan.
it's a little thing to do to like make them feel like they're being treated just like everyone else, but it's also a little thing not to do that makes them like it's more just makes it even more prominent that they're the minority and like not being treated the same.
Mhm.
All right. I feel like we might have answered some other questions throughout that conversation, but we're just going to go through them anyways. Were any professional lines blurred or crossed?
It's hard. It's like kind of hard to answer that question. Like,
Yeah. I mean, I guess, would
I
you
mean, if
necessarily
we're
consider
talking
a
about the,
professional line? Like,
well, if we're talking about the nurse not doing proper discharge, that was a professional blurred line, I guess you could say, or the doctors and the translators not working together as a team. I don't know. That's
Or the doctor trusting the older brother as a translator. Maybe that could be a professional line. to be
Yeah, that's a good
crossed.
point.
And just like the doctor is thinking like, oh, they kind of understand what they're signing for, but it's going to help them anyway. So like they're going to want, like, that's like a blurred line. 'Cause it's not like, how do you know that they want that? Or how do you know that they understand what you're saying?
Yeah. Okay. What actions could have been taken by the medical staff to ensure Ying received the proper education?
I feel like that goes back to what we said before about like they could have just easily gotten a translator. I feel like they also could have found like I know sometimes they have the pamphlets and stuff that are in other languages, like giving them educational materials like that that they could take home for them, like for them even in the future, because I feel like strep is so common, like signs and symptoms to look out for and like why it's important to like take antibiotics early on and just stuff like that. But just doing like the little things to make sure it's in a language that they can understand.
Yeah, I think also like if they help them maybe first see, do they have like doctors set up in the like do they have a doctor? Could they help them maybe set up with like a follow-up appointment or finding a doctor, just so that they weren't like leaving and then like not following up at all, or not like, because I feel like sometimes it can be hard to trust that the patient's going to call when they get home. So it's
Mhm.
just easier to have the discharge set up, like the discharge for the follow-up appointment set up before they leave, you know?
Yeah, I think the huge thing was just there was zero like education on discharge for them for like, and since they're not used to going to regular doctor's offices, they're not going to know like, oh, maybe I should call and just check on something. Like they don't know to do that. So there's just lots of things that they did wrong.
Yes, and especially that she came back positive for being more
Mhm.
susceptible. She's just
Right.
at an extremely high risk to have further issues down the road if she ever really gets strep again.
Can't you
Yeah.
get like I know this is totally unrelated, but can you get like endocarditis from get strep? Like going
Yeah.
on too long? I feel like that's what Jim Henson died from. He
Yeah.
had
I think so.
strep. Yeah.
I feel like
And
maybe even the nurse should have recognized too, maybe, right? Like, oh wait, I don't think they had any discharge teaching or education. Maybe I
Mhm.
need a doctor, or maybe they had some information they could have given the patient themselves.
Yeah.
Yeah, I see this as just a situation of like that entire healthcare team was just trying to get this patient out of the hospital ASAP. And like just a total breakdown in communication and really like lack of care, which I think comes back to being because they're Asian.
yeah, a lot of doing things the easy way instead of the right way.
Yeah.
All right, last question. Did all characters present have Ying's health in their best interest? And if not, who did? I personally think a few people did, but because like at first, like Wei obviously did when he's trying to use the traditional medicine, and then eventually they go to the hospital. And I think the doctor also did because he wants to do this genetic testing because she may or may not be more susceptible to these things. But it seemed like everyone who did have her health in the best interest also kind of, like Sarah said, just dropped the ball at certain points too. Like, I don't know, not everyone kind of followed through. They all stopped at some point and didn't do the rest of what they should have.
What's the brother's name? Is it
The brother's way.
Wei? Like I feel like maybe to someone that isn't in their culture, it might seem like he's like being like overstepping and whatever, but I'm not sure about Chinese culture, but I know some cultures like the men speak for the women and they're the ones that, you know, are going to be the ones making decisions and whatnot. But I think he had the best interest for his sister. They just aren't as educated on Western medicine. And I think as a healthcare professional, you need to recognize that and maybe take a step back and also make sure that the patient themselves has an understanding before having them sign a consent form, whether you want them to get the genetic testing or not. Like you need to make sure the patient understands what they're gonna sign for, you know?
Mhm.
Francesca, I kind of cut you off in the beginning there. I don't know what you were gonna say.
Oh no, that's okay. I was just gonna say that yeah, I think at different points they had the patient's best interest in mind. I think Yang like had his sister's best interest in mind, but I think that just the way he grew up and like was used to doing things kind of clouded it at first.
Yeah, I feel like everybody had her best interest, like at some point or another. Like they all eventually came to the same conclusion that she needed help. But they just dropped the ball. So.
All right. Does anyone have any last input before we
Good
stop
job,
recording?
AJ.
Thank you. All right, I'm gonna stop recording. If I can find the button.